Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten, and I'm joined by Dr. Discoe today. Doctor, how are you doing?
Good.
So I guess we'll start off. Tell me a little bit about what it is you do.
Family physician here in Columbus, Nebraska. Been here about almost 20 years. I guess I haven't done the arithmetic lately, but about 20 years. That includes just seeing patients on a day-by-day basis for acute and chronic problems.
Well, talking about being here for that long, you've obviously seen a lot of different patients, but a lot of the same patients over a long period of time. Is that a reason you got into this family practice type of medicine, is so that you can work with patients over a long period?
Sure. When you're in medical school, generally during your third and fourth year, you get a nice insight into what all the specialties are like, and I found myself kind of liking a little bit of everything, or not enough of just one to continue to do that. And then that was further solidified when we're required to go out and do a month-long rotation in a family practice setting out in the state, and I found myself attracted to that, and also to just the size of communities that were good communities for a family physician to go back to. I saw myself in that type of a situation more so than anything else.
We're really talking too about that 20 years. When we look back those 20 years, a lot has changed with the medical scene here in Columbus. What is kind of the growth you've seen over time?
So I think Columbus is a unique community. It's real different than other communities around the state of Nebraska and really the nation as well. There's a real nice symbiotic relationship between the hospital and the administration and really all the physicians in town. I think we all get along together, kind of like we're in our own little multi-specialty organization, and there's a lot of respect and camaraderie that exists even between competing clinics. I don't know what or why that developed early on, but I've seen that just kind of prosper over the last 20 years. So it makes for a real nice community to practice in, because you always feel comfortable in how the patients are getting taken care of when they go see the specialists that are within our community.
Well, you mentioned this a little bit, but can you walk us through your kind of educational background to get to this point?
Sure. I attended the University of Nebraska, Lincoln. And then after that, I went to the University of Nebraska Medical Center. After that, I left and went down south to Kansas to a program that was, I think it's called the Via Christi Residency Program now, but a family practice program down in Wichita, Kansas, before I moved to Columbus. That was my one and only stop.
And you've raised a lot of kids here in town, and you still got some kids that are in high school. What's it like been raising a family here and practicing over those many years? It seems like obviously you don't have any intention to leave, I don't think.
Yeah, no. No, it's been a good experience for us to have our kids go through the Columbus public school system. I think the community is much like I'd expected when I said I chose family practice. That was part of the decision. It's a good community that offers a lot of opportunities for the kids in the school system, and with activities outside the school system. It's been good.
The flu is kind of spreading around right now across the state of Nebraska, and as a family physician, I'm sure you've seen some of that coming in here. Is there anything people can do, I guess, to kind of prevent that?
Sure. I mean, I think the initial way to prevent influenza is to get a flu shot. I think the jury's still out as to whether that flu shot worked this year. We're seeing patients that have had the flu shot and have developed the flu, and then some people who are immune to the current acute flu or influenza. I think just in general, because we're also seeing mumps in the community as well, which is kind of unique. But in general, just viral illnesses, I think good hand washing technique and covering your mouth when you cough, those are all good things. But I would also add that if you start developing the flu-like symptoms, that it's good to see your physician or have some interaction with them, because there's medications they can prescribe that'll shorten the course and maybe decrease the risk of having a exacerbation of that problem.
Okay. Well, not only the flu, but just preventing anything in general and trying to stay healthy are some things that are steps people can take?
Yeah, I think healthy lifestyles have really been moved to the forefront of what we take care of nowadays. When I first arrived, it was taking care of a lot of the acute exacerbations of the chronic problems, and now we really focus on trying to prevent those. And so we try to get people in for wellness exams on a regular basis, yearly, if not every 2 years. And sometimes it's a little longer than that, but at least on a regular basis, so that we can assess their risk factors and then encourage them to adapt a healthy lifestyle. We also want to make sure that they get their screening procedures, such as a mammogram and appropriate women wellness, colonoscopies, DEXA scans, those types of procedures that will allow us to maybe get ahead of the curve for a chronic or acute exacerbation of a chronic problem. So I think wellness is a real important part of it. If we can stay active and keep our weight down around a reasonable range, we can probably decrease the chronic medical problems by 75 to 80% in the long run.
Well, Dr. Discoe, thank you very much.
You bet. Thank you, Grant.
And thank you guys for tuning in to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. For Dr. Edward Discoe, I'm Grant Otten. We'll see you next time.